Let me ask you something. If you are a woman over 60 or a man who has seen a few decades and your knees hurt when you climb stairs, and then someone scanned your bones and said, you also have osteoporosis, what did you walk away thinking? Two problems, two doctors, two prescriptions. I want to tell you why that picture is wrong and why getting it right changes everything about what you do next. You don't have two diseases. You have one story being told in two places. Here is how it usually goes. You see one doctor for your knee. He looks at the x-ray. Cartilage is worn. Cartilage தேஞ்சு போச்சு, குருத்தெலும்பு தேஞ்சு போச்சு. The joint space is narrow. Joint space குறுகிருச்சு. He says arthritis. Maybe an injection, eventually a knee replacement. See another doctor for your bones. She looks at the bone density scan, usually called DEXA scan. The number is low. She says osteoporosis, a weekly pill, vitamin D, 2 clinics, 2 file folders, 2 stories that never meet. But your body never received that memo. Your knee is not a hinge bolted onto a skeleton. Your knee is the skeleton. The cartilage on top sits on bone underneath. They share blood, they share nerves, they share the same upstream environment. So what happens when that environment goes wrong? After menopause, estrogen drops. Vitamin D often follows. Inflammation simmers quietly under the skin. You cannot feel it, but your tissues can. Sugar runs higher in the blood, fat runs higher in the blood. These do not pick a target. They damage everything. The cartilage thins, the bone underneath weakens, the joint hurts, the hip cracks when you fall, fracture agum. Same cause, different addresses. Osteoporosis and knee pain after 60 are not two unlucky coincidences. They are the same metabolic weather raining on two different roofs. Now, here is something most people are never told. Researchers studied a large group of patients with knee arthritis. At least 1 in 6 of them also had osteoporosis. And in those people, the pain was not coming from where everyone assumed. It was not the cartilage on top, it was the bone underneath. Think about what that means. If your knees hurt and your bones are also weak, then a knife and a metal joint will not address what is actually causing your pain. Because your pain is not really living on the surface, it is living in the foundation underneath. The two standard answers, they each fix one and miss the other. A knee replacement removes the painful cartilage. It does nothing for your bones. In fact, the implant sits in that weak bone, and that weak bone is exactly why some of these implants come loose years later. A pill for osteoporosis strengthens the skeleton slowly over years. It does nothing for the inflammation in your joint, nothing for the cartilage, nothing for the pain you feel today. Each treatment is locating the failure in the wrong place. You cannot solve a metabolic story with a mechanical answer. And you cannot solve a joint story with a bone pill. What you need is something that addresses the actual cause and the actual location. That is what PRASAD does. We start by reading the upstream weather. 4 simple markers in your blood. Your sugar control, vitamin D, your inflammation level, your fat balance. These tell us the soil. We fix what is fixable before we plant anything. Then we restore the joint biology, not just the surface, inside the bone, underneath, whereas the research now shows a great deal of the pain actually lives. Your own healing materials, refined and delivered exactly where your body needs them. We do not replace your knee. We do not simply prop up your bones with a pill. We address the story in the place where the story is being written. Vara Prasadam. நான் இன்னைக்கு சொன்னது, what I have told you today is that osteoporosis and osteoarthritis are not two separate stories. ஒன்றுதான் கதை, one story. வீட்டோட கீழே இல்லை பிரச்சனை, a problem in the foundation of the house. கொஞ்சம் நில்லுங்க, wait a moment. There may be another path, one that works with your body's own biology, not against it. If you have knee pain and if you have been told your bones are also getting weak, இல்லை உங்களோட ஃபேமிலியில் யாருக்காவது இந்த ரெண்டு ப்ராப்ளமும் இருக்கு, or someone in your family has both of these problems, call the clinic on 0956 6143 and book a consultation. You can also write to drvenkat joints joints@gmail.com to book a consultation. கன்சல்டேஷனுக்கு வரும்போது உங்களோட எக்ஸ்ரேஸ், எம்ஆர்ஐ, டெக்ஸா ஸ்கேன், ரீசன்ட் லேப், HbA1c, வைட்டமின் டி எல்லாத்தையும் கொண்டு வாங்க. when you come for the consultation, bring all of these with you. நான் உங்களை பார்த்து ஸ்கேன்ஸை பார்த்து லேப்ஸை பார்த்து அப்புறம் நேர்மையாக சொல்லுவேன். I will examine you, look at your scans, look at your labs, and then I will tell you honestly whether you are a candidate for the PRASAD treatment, இல்லை ஜெனுவின்ல சர்ஜரி தான் வேண்டுமா, இல்லை மெட்டபாலிக் கரெக்ஷன் தான் போதுமா. 3 ஆன்சரும் நேர்மையான ஆன்சர். All 3 answers are honest answers. நான் உங்கள் சைடில் இருக்கேன். I am on your side. In our tradition, Prasadam is what is given back after grace, a blessing, something proportionate, something honored. Prasad is named carefully. It is your body's own gift, returned to the place that needs it. Nothing borrowed, nothing forced, nothing that overshoots the problem. If you have been told you have osteoporosis and your knees hurt, please don't accept that you have 2 separate diagnoses heading down 2 separate paths. You have one upstream story, and there is a way to address it that fits. Find a doctor who reads bone and cartilage as one tissue, not 2. For the full PRASAD treatment, what we actually do, step by step, that video was released on April 12th, linked below. Next Sunday, June 7th, நான் osteoporosis பற்றி கொஞ்சம் ஆழமாக பேசுவேன். Next Sunday, June 7th, I will go deeper into osteoporosis itself, what your DEXA scan really means, and why the medication you may have been offered treats only half the problem. என் பேர் டாக்டர் A.K.Venkatachalam from the Madras Joint Rejuvenation Center.